Good day to one and all. I hope in our midst there are people who are still excitedly looking forward to very natural and healthy conception and of course pregnancy, which is the topic that we're going to talk about today. So this is my part two of the session that I've shared. For those of you who attended my January session, I did talk about the importance of doing a proper body overhaul in preparation for conception. So this is the best thing that we can do as parents or parents to be, to give to our unborn child the first right to be very naturally strong and healthy. Today's topic is on optimum and nutrition. Prenatal health for strong mother as well as strong immunity baby. This is my profile for those of you who attending this session for the very first time. My name is Lydia, as Chun Yan had introduced. My area of training is in holistic nutrition. So I love to see people getting well without drugs, I hope, or for people who are already having some medical challenges or medication. When I work with them, of course, I'm hoping that the intervention of using a sound and a natural and effective way will eventually help them to be less and less dependent on the medication. And eventually, if we can get them well naturally through the dietary and the whole aspects of holistic nutrition and lifestyle changes to actually allow the body to heal, the body will really be able to naturally fight all the ills and symptoms. The same thing will go to the symptoms that we see women experiencing. So the questions I want to ask today is: Do you really think that a pregnancy should come with all the suffering, or in that sense of the discomfort, like morning sickness and then the cramps and what have you, and many other discomfort of vomiting, nausea and all that? Well, I hope today after the session, you will know that these are the symptoms that don't really have to accompany with what is really a natural pregnancy from the first, from conception all the way to giving birth. The information I'm going to present here today is for educational purpose only. This is not a prescription for self-diagnosis or self-medication. Please consult your physician regarding the application of any opinion and recommendation with respect to your symptoms or medical conditions. For those of you who are choosing a higher path of health, I call this a higher path because I really believe that this is a better way to go, is that our role here is not to give you or promise healing or to give you a treatment. Our role here is essentially to impart the knowledge to you so that you can take on this knowledge and apply on your own in the comfort of your home or wherever you are, and that you take charge of your health to be symptom and disease free. Or even for that matter, the topic that we're going to discuss today is about how to really enjoy your whole process of pregnancy and looking forward to see your unborn really in a very joyful and a relaxed way. So before I start the session proper, I thought I want to share with you what I penned down for parents. And let me share with you here. Every unborn child should be given the birthright to be healthy. I always believe in that, and that's part of my work as well. And a big part of that right is actually in the hand of the parents. From conception to birth, your unborn child is totally dependent on you to give him the right nourishment and the environment, whether he is in the womb or at birth or coming into this world to be birthed. To be in the best possible state of health and having a strong immunity, starting him right on the foundation to thrive and to be ready to face the world at birth. So this, I hope, will give the inspiration to parents to really go on the path of natural conception, natural pregnancy, and I hope natural birth, so that you can actually prevent this innocent and very fragile, but yet a miracle being created by God to face the world at birth. Not having to go through any trauma at all. We call it needle, we call it knife, we call it burning, we call it, whatever drugs that need to be given can be very, very traumatizing for the child. In a natural sense, I don't think this should be the way. And this, I hope, can be prevented. If you know holistic nutrition and what from the human body from conception all the way to birth. Now, I want to recap the 6 pillars of a holistic health. That means total health for the total person. We are not just flesh and blood, right? We have emotion, we have a will, we have a spirit in within us. So I hope that the session today will help you look into health beyond just a physical realm. Well, you know, for some people, taking a drug means nothing to them. But for me, I'm beginning to think about the chemical imbalances, the toxicity. And for some people, you know, cutting off one organ and you know, transplanting another organ into another from one to another human being, it's also, you know, they don't really think about it. But I'm always thinking about in the law of nature, what it means is symptomatically, well, we may fix certain things, but then as a whole, we probably will not be able to see health and healing unless we are able to go onto the higher path of natural health and natural healing in a very, very holistic manner. So holistic health, basically, I want to share with you the 6 main pillars. The wafer lifestyle. Water is important. I talked about that during my last session. Air, fresh air, doing diaphragmatic deep breathing as well is very it's a natural pain relief, and it's also very relaxing to take away the stress, right? Instead of taking anti-stress or depressant and all that, do you know that diaphragmatic deep breathing or doing exercise or doing, you know, a very intentional breathing can actually bring a lot of relaxation and calms down the whole person as well, and many other benefits, which I hope that in future I will be able to share more. Food, oh, glorious food, right? I would think that food is a very big part of our health. So the food that we are advocating will be a natural or whole food. Exercise, rest, and then sunshine. Sunshine is not the vitamin D, although we get a lot here in our tropical environment here, but the sunshine, I'm referring to our inner health, how we feel, positive emotion, positive mental health, and of course spiritual health. So when we are able to embrace these 6 pillars of health, whether you talk about childbirth, you talk about any management of health issues, I do believe that they are a lot more promising for real healing to take place when we are able to nip them at the bud, and then over time able to make changes to fulfill these 6 pillar of health as a platform for natural health and natural healing. Now, today's topic is on prenatal. Prenatal simply means, you know, from conception all the way to the time where you actually give the woman actually give birth. So overall, I will give you this overall canvas. And then from there, I'll break down into some details for you to take on. Whether you're already pregnant, I congratulate you. This is an amazing journey that you're going to be on. Parenthood is not without pain, but I think it's one of the most fulfilling experience that any human being can actually receive. The dietary guide for during pregnancy, the rule of thumb will be number 1 is to eat healthily and heartily. Well, it's a little bit different. We eat different way in for different purpose and at different time. Now, during the last session, I talked about what a person should eat when he or she is trying to do detoxification. It's not to eat heartily, right, when we are doing detox, but is to eat well and to eat clean, eat whole food, eat plant food, and eat a soft or liquid diet when we are in that season of doing cleansing, detoxification, and then putting in the powerful micro and macro nutrients at the right amount during the detoxification time. But when we talk about pregnancy, the aim and the whole goal about the aspects of eating well and eating healthily and heartily is about building, it's about holding, it is about nourishing, it is about strengthening to allow the woman to carry and enjoy the whole pregnancy process of the 40 weeks or so, almost by about 9 months. So Full-term baby can be around 40 considered when birth, from conception to the time of childbirth, about 40 weeks. Now, the overall rule of thumb would be to eat a very well-balanced diet. Well-balanced, I mean that you should not be depleting or removing any group of food. That means to say there are always purposes and benefits of why we why we have access to all this natural whole food that has got this all food groups. So sometimes people say, oh, I want to lose weight, therefore I cannot take carbo. I beg to differ. I think we have to eat carbo, but we eat carbo the right type and then the right way and in the right sequence to be able to lose weight. But it's not to totally cut off carbo, because there are fewer food, and all the more for a pregnant woman, complex carbohydrate is to give the body enough calorie, enough warmth or heat, enough fuel. It's a very, very important consideration for a healthy diet for a pregnant woman. Then of course you have the protein, you have the good fats, you have the fiber, you have the micronutrients, you have the macronutrients, and then you have the enzymes, antioxidants, and the cofactors. So this whole understanding about whole food, I'm not able to cover today, but I just want to show you in pictorial form and as brief and as easy for laymen to understand, so that you get an idea. And then if you want more details specific to cater to your first, second, and third trimestral kind of dietary guidelines, you can always feel free to keep in touch with me after this webinar. Natural whole food is the way to go. So, and all the more for example, remember mothers or mothers to be, everything you eat either deplete your health and deplete your baby's health, or build up and strengthen your health and your baby's health. So the concept of natural health is about eating whole food. Then I will talk about the different groups of whole food, and then the amount that I think generally meet the needs of the whole pregnancy. To the best that you can, you should choose organic. Organic means that this produce, or this, even for those of you who are not choosing to be vegetarian, in a sense that your meat or what, to the best that you can, you should be taking organic as much as possible, so that you are not taking in a lot of pesticides, chemical, agricultural toxins that can be very, very detrimental to your health and your baby's health. And the way to eat for a woman during the pregnancy is not to whack and then eat a lot of more than usual, even though you may think that, oh, you are pregnant and therefore you have to eat enough for yourself and also eat enough for your babies. But the way to go is not to go on very, very big meals, because nausea, indigestion, and very clogging for the colon can happen as well. But overall, the rule of thumb will be, try to break your meals down into smaller, comfortable meals, but over 6 times, instead of squeezing them into 2 or 3 meals like a normal person would eat. Low fat, high carbohydrates, it's one of the emphases as well. And carbohydrates, I would classify that as wholesome complex, because you need higher calorie. Whether you are breastfeeding or you're right now preparing, or rather pregnant, you just cannot stinge on your calorie. That's not the time to go on a weight loss program. Remember, now is a time to focus on eating heartily and healthily, and eating enough and a balanced diet to fulfill all your nutritional intake and from the diet. And then if diet has got some shortfall, I will be discussing on whether it is safe to take supplementation during pregnancy. But this the food that you should straight away look into removing it, whether or not you're pregnant, but all the more when you're pregnant, because it's not only going to affect how the outcome of your health. If you're healthy and strong, your baby has a better chance to be strong and healthy as well. And similarly, if there's certain some depleting factors, or some chemical imbalances, or some missing toxemia and nutritional deficiency that you're exposed to internally or externally, your baby can be in a way a recipient of these ill health factors as well. So hydrogenated fat, refined cooking oil, like margarine, the vegetable shortening, omega-6 oil, all the refined oil that you see in the supermarket, by and large, they are called bad fats. Those should be cut out. The other whites that you want to be very careful about and try to avoid will be white salt, white sugar, white rice, white flour. So I'm not saying don't take carbo. On the contrary, I think carbohydrate is one increased need during consideration during pregnancy time. The only thing is that you ought to be eating the right kind of carbohydrate. So non-refined, that means in their most original form, like brown rice versus white rice, wholemeal bread versus refined white bread, and then with produced or manufactured or prepared without chemicals or preservatives. Processed foods and dairy. I want to discuss about the good and the bad of dairies, but I will be talking to you about one very important food for pregnant women is called yogurt, how you can make organic, really organic homemade yogurt. Pastries, red meat, and GMO. Let me revert back to red meat. I am not saying don't eat meat, although I personally feel that even a pregnant woman will do very well if she is on predominantly, if not fully, kind of a vegetarian diet. But the other shortfall of being going vegetarian for all the more for pregnant women is that they can have got some, if they're not knowing how to balance their meal, right, not eating well-balanced diet from the plant food that covers all the groups of the nutrients, micro and the macronutrients group of from the food that I just mentioned earlier, then the vegetarian can go into very common nutritional deficiency kind of a situation, and that may not be supportive for a healthy pregnancy as well. So by all means, if you think that you want to go vegetarian, whether it is for religious reason or for health reason, I am very, very supportive of that. And I think that it's a very high path of health as well. But if you think that that is not an option and that you find that you want the iron from the meat, not having to worry too much, if it doesn't concern you about clogging of a colon, being very acidic, which is disease causing, or being constipated, then I think you at the in terms of the red meat, number one, the rule will be to go for organic meat as much as you can, wild caught. If it's a fish, wild caught, not farm reared. They are loaded with a lot of hormones and growth stimulants that can be very, very disruptive for the hormones as well. So you know that you need to balance your hormones even during the time of pregnancy. GMO food like soy, highly genetically modified, or any food that you know that commercially prepared or produced, you want to avoid them to the best that you can. Another overall dietary choices will be eat foods which are in their most original, natural, organic, whole food state. And of course, you prepare in a way that they're supposed to be properly. Eat a very well-balanced diet, including the right amount from all groups of whole food categories. So you do not want to go on ABC diet or XYZ diet that say, you cannot eat this carbo, you cannot eat the vegetable, you cannot eat fruits and all that. So you need to understand that there must be a reason. You go by your natural, the way the human bodies are created. It's amazing. And there must be a reason why nature has it that we have all these groups of food naturally occurring from available for us. So you should be taking into consideration the foods that serve their purpose and the health benefits from every group. Do not remove a certain group that are necessary for health, and each have their own, has its own purpose and health building block consideration. Phytonutrients, the vitamins, the minerals, the antioxidants, the carbohydrates, the fiber, the protein, good fats, enzyme, and many co-enzyme factors and many others. You want to be very intentional about making sure you have a very complete and well balanced approach to your dietary choices. I want to focus on pregnancy, particularly the increased need for folic acid, iron, calcium. Not that is all there are. But then I find that most of the women, if they're not careful, they are or not intentional about making sure that they have a complete or well-balanced diet. They commonly have these three groups of nutritional deficiency that can potentially affect the growth, and in very detrimental way, it can even have the higher risk of having certain kind of birth defects. Cooking method is another consideration in your dietary choices. Avoid deep fried, stir fried, barbecue, or even microwave. I am really not encouraging people to go into microwave food because it can destroy the protein the protein molecular structure of certain groups of food, and they are very cancer causing and very detrimental for the mother as well as the baby. Go instead for healthier choices like steam, stew, soup, grill, or roast. Healthily prepared kind of food. If you think that you want to include some cooked food, that's fine. But I would suggest that you want to pay really a lot more attention on taking organic fresh fruits and vegetables, which under normal days or even during the pregnancy, they are loaded with a lot of vitamins, minerals, and these antioxidants and enzymes. They're very health building, and to ensure that you are very well supported with optimal nutrition during pregnancy with this predominantly a plant-based diet. There's no difference even when you are doing having a pregnancy, or if, like I said, if your choice is to be vegetarian, then please put into your vegetarian meal plan a very complete careful planning, so that you're not missing out on certain nutritional intake, particularly the iron as well, because I find that a lot of vegetarians are very anemic because they don't really get enough from the choices of the abundance of the plant food. They're loaded with iron. Read the labels very carefully, intentionally avoiding chemical processed packaged food. Medication should be kept to the bare minimum, best omitted. So you want to discuss with your doctor about the safety of using certain drugs, whether short-term or long-term. And you want to really be educated enough to take charge of your own health, because I always feel that a lot of drugs out there, they are being prescribed. They are not really necessary. If you have a better option, like using food as a medication, which I'll be sharing with you how to overcome some of these health challenges, that you can actually explore food first as a first line of defense, rather than to be in a too quick a mood to go into certain medications. Always remember that the more medication you take, the more chemical imbalances is going to, and toxicity that is going to affect you, and also your fetus. So that has got a bearing on how your baby and in terms of his immune system, even before birth. So you want to also be very careful about rampantly, off the counter buying all sorts of supplements. I am, supporter for very good and useful supplements, but I would just want to caution that not all supplements are created the same. In fact, I think when we evaluate from a natural health perspective, when we evaluate a lot of commercial supplements out there, I'm just as, in a sense, concerned as drugs, because while people may think that supplements are safe, but they may not be safe after all, because they can contain a lot of chemicals and preservatives, and can be very detrimental and very burdensome to the kidneys and the liver as well. So I will discuss with you what kind of supplements are good and what are the benchmarks, or how you should be selecting supplements during pregnancy. So your pregnancy diet, basically, let me just break down into a few major groups so you are more aware. First, because pregnancy takes a lot of energy, your body needs it and you need the extra calorie to hold the pregnancy, and not only to support your health, to keep your body warm, for energy, and to give you the satiety. At the same time, you also need to know that your baby, as the fetus grows in you during the third trimester, there are increasing needs of these nutrients to support the growth and the health of the fetus. Vegetables, try to eat rainbow variety of colors as organic as possible, 3 to 6 cups a day in general. So whether you're talking about first trimester or the final trimester, it's not going to drastically change a lot, except a few exception that I'm going to share with you, some essentials like calcium, that the need for calcium will need to keep on increase. You have to increase the intake of the calcium at this trimesters phases, and in an increasing manner, because that's very important for your bone health as well as for the development of your fetus. Fruits, same thing, try to go for a variety of fruits, should be about 2 to 3 cups. And vegetables, like I mentioned earlier, omit cooking method, which are loaded with hydrogenated cooking oil or commercial seasoning. So you can eat salad, but be very cautious about cleaning your salads and your raw fruits and vegetables very well. For us, right, we advocate using hydrogen peroxide, which is a food grade. I'm talking about the center, the New Life that I partner with. We have a food grade hydrogen peroxide and dishwash. They are meant for vegetable and fruit washes as well. So hydrogen peroxide is very important, especially if you want to prevent the worms, parasites, or even the bacteria on the fruits, raw fruits and vegetables that you're eating, and also to prevent diarrhea. So it's very important for you to learn how to wash your produce very carefully. I have got videos of workshops that teach people how to do juicing, how to prepare their salad and their dressing very healthily and in a very clean manner. So do join us if you're keen. Good protein, 5 to 7 ounces. Predominantly, you want to go into the legumes, the beans, sprouted. Sprouting them is very important because it will affect the way you digest them. And it's also to minimize the bloating and the gas. Well, if meat is something that you must have, organic to the best that you can. And I would think that even if you are a meat eater, right, during this time, it's not something that you need a lot, more for emotional health rather than to think that, oh, your health depends on it. But you need to just compensate it. If you're not eating, let's say, a lot of meat, then what about the iron and all that I will address later. Choose predominantly, or if you are already a vegetarian or plan to be a vegetarian, I'm not against it, but I would think being balanced and being sound, in including all groups of foods, very important for you if you still want to be a vegetarian. Calcium, you can take from dairy, but dairy has its pros and cons as well, which I will address later. I would suggest that the safe dairy I'm talking about must be organic, low fat, for pregnant women, and ideally made into yogurt, because yogurt is a very, very healing and supportive for food as a staple. I would even say that it's a staple food for pregnancy kind of a diet, because the protein is very digestible. There's a lot of friendly bacteria, a lot of calcium, a lot of magnesium in there, and these are the essential needs of a pregnant woman. So calcium for the first trimester, I think we are always talking about 750 to 1000 mg, depending on the diet. But as the pregnancy progresses, right, it's very important to intentionally include a higher amount of calcium. Good fats is another very essential part of development for the baby and the mother's immune system and hormone regulations as well. I would suggest really for pregnant women, the best oil you can go for is actually the organic cold pressed flaxseed oil. 2 tablespoonfuls is all you need. Another very important consideration, whether you're talking about diet or when dietary shortfalls are there, that you're not able to take enough folic acid, right, then you may have to look into some other concentrated form of folic acid, either from a whole food supplement or as you discuss with your doctor. Folic acid is so important that I would think that if you are at the age where you know that there is still a possibility or within your desire to ever want to conceive again, you do not wait for the folic acid to be taken only during, the pregnancy time. You should start taking folic acid for as long as you know that you have a chance to ever get pregnant. And we're talking about 400 to 800 mcg for a start, and then the need may increase for some people with certain risk of certain child defect or nutritional deficit. Iron is another major consideration. Having enough iron supports pregnancy, very healthy pregnancy, and it's very important to draw the oxygen and the nutrients to your babies for its his development as well. So let me just give you in picture form that when we are talking about vital dietary and nutritional intake for pregnant women, you have to focus on, of course, being balanced is one part of it, but predominantly you want to make sure that you have the B complexes kind of food, the folic acid, the omega-3 mentioned. I mentioned to you flaxseed oil, right? Then the seeds and nuts have a lot of omega-3 as well if they are properly prepared. Vitamin C, fiber, antioxidant, protein, calcium, iron. Selenium is a kind of antioxidant. You get a lot from the grains as well. And then another group of food that's very, very important for tissue building, immune system, and certain parts of the organs development for the fetus is actually zinc. So you want to take your pumpkin seed, you want to take bee pollen, you want to take a lot of these seeds and nuts that are loaded with zinc as well. And taking oats is very important as well, because oats not only brings down the cholesterol, gives you the complex carbohydrate, it has a lot of zinc. So eating oats as a breakfast or as a snack, you know, in whichever way that healthily prepared is very, very supportive for a pregnant, very well balanced kind of dietary intake for very healthy pregnancy. Now we talk about iron. Another group of food that we want to include is iron, very essential to produce red blood cells. You need to double the dosage during pregnancy time. So when we are talking about a commoner needing about 10 to about 15, for a pregnant woman will need about 20 mg to 30 mg. And then of course, if you are not taking iron enough from your diet, right, any kind of supportive supplementation, I am really concerned, because I am not really thinking that prescribed synthetic this iron is good in that sense, because a lot of them after taking, right, the tablets, we're talking about those black red tablets of this prescribed iron, they get into very they feel very heaty, they have ulcers, and they're very, very constipated. I would suppose that the iron, that when we do natural health, right, nutritional healing part of it, I would always ask them to take some green juices. I ask them to take some power concentrated whole food in the form of supplements, in the form of spirulina, as opposed to iron tablets. So always choose what is closer to whole food nature, and then you get less side effect and it's less burdensome for your kidneys and your liver. So the iron need is very important, because it also helps to supply the blood, nutrients and oxygen to the baby. And the baby's growth, overall size and the growth and development, a lot depends on making sure that you have enough iron. So we have a lot of iron, you know, not from meat predominantly, actually. It's a lot of iron from plants, over even we talk about beef. I am not into heavy beef, you know, a recommendation for pregnant women. In fact, they should remove it if they can. But if they feel that they just enjoy and they feel everything that they have iron, I would say that that's not the best way to get their iron. In fact, the best way to get iron is from your plant food. Predominantly those very leafy, dark leafy green. And then if need be, then you look for a concentrated form of whole food supplement before you even consider any kind of prescribed tablets of the iron. All right, so this is one my personal view from a naturopathic health perspective, that we already have enough iron from plant food, not really from meat in that sense. Then the question that most people ask will be, what about herbs, right? Herbs, I would say that there are certain herbs like raspberry leaves and all that, you drink it a little bit as a tea and all that, it's okay. But when we are talking about the first trimester, especially the first 12 weeks, where pregnancy can be very challenging, it's not stable yet, right? You really want to avoid these herbs. Time does not permit me to go into the reading, but you can take a snapshot, or if you want me to send you this list, I can send to you. Now, just in case you wonder, oh, aloe vera is so good, why is it that it's not for pregnancy? Remember, during pregnancy time, the focus is not to cleanse out your whole fetus as well, or expel the fetus. The way we eat or any herbs or any nutrients that we are taking in, the purpose must be have the purpose to hold, to strengthen, to tone, yeah, and to build. So aloe vera is considered a cleansing kind of the diet. So cleansing, too much of a cleansing diet is not recommended during the pregnancy time. But when the pregnancy is over, everything is back to normal, right? Then of course you can enjoy aloe vera to cleanse out whatever toxins have been accumulated in the body. So then the other thing is tong guai, right? The tang gui. Some people say 补血, right? That means it's a toning. I would rather go for the greens than this strong herbs called tang gui in that sense, because tang gui is known to promote blood circulation. So you do not want to promote it too fast, and that the fetus get expelled out of the body. So knowing that even within the categories of herbs, some herbs are for building, some herbs are for detoxification, some herbs are really for expulsion as well. So during pregnancy, you want to really be very careful about minimizing, or to the best that you can, avoiding these herbs, especially during the first 12 weeks, because pregnancy is not stable yet. What about supplements during pregnancy? My answer and my take, and I have seen so many natural birth, very healthy birth, even in very different challenging situation, right? They do get a very good outcome. My take about supplement is this: yes, it's very, very necessary for pregnant women to take some supplements, because we are living in an environment where a lot of time we are getting ourselves into 40 diet, very stressful lifestyle. Already, if we are stressed, coping with family, coping with work, and coping with a pregnancy, very demanding. So it can get into all sorts of challenges, depletion of the B complexes. Just stress alone can really deplete, a lot of our B complex reserve, and that can cause some defects in the baby as well. So where you don't have really 100% foolproof control over diet and your lifestyle, and even the environment, right? We live in contaminated and very toxic environment these days. Some supplementation are very, very supportive, and I would even think very necessary. But I would caution that you have to approach supplements with very careful scrutiny, and be very cautious about what type of supplements that you are choosing. I would say that the supplements are needed because they are needed to correct toxin buildup in the body. For example, a lot of women who are pregnant, they're very intoxicated and they're very tired and sleepy because they are very constipated. And the toxins are, in the fecal matter, rotten, putrefied, fermented food, undigested fecal, or rather clogged up, fecal matter that cause them to not be able to pass bowel, will cause the toxemia, blood poisoning. So we have to have some food, and then we have to have some supplementation. They're very naturally say to help them expel the fecal matter. And so that's one way, a concept about removing toxins in the body. Nutritional deficiency due to dietary and lifestyle shortfall. Prevent birth defects, mental retardation, and to protect the baby and the mothers against certain complications. This is something that a lot of time laymen or people on the street who are pregnant, they really don't know what to include, what to remove, and therefore supplementation is the next best that they can go to protect them in as natural as possible kind of a way. Choose supplements very, very carefully. Go for, number one, your first line of defense when you're choosing whole foods, the supplements will be to go for natural whole food based supplement, not the extract first. Go for the whole food base, naturally extracted, or in a process, in a sense, in a way that is being presented to you if you were to buy the supplement. That's why I am into spirulina first before I look into all the ABC tablet, standalone, the D, the E, and all that. Because the more natural the supplement is, the closer it is to its most original form, whole food, not extract. the better it is, and the less synthetic chemicals needed to be added in. So you want to also be very careful about all the multivitamins and all that, because a lot of them are loaded with a lot of synthetic chemicals as well. And supplements are necessary because they actually help to strengthen the immune system, both for the mother and the baby. So I give you one very simple example of what I think I'm concerned about when people are just going to off the rack and buy any kind of supplement and reading the label without reading the ingredient list, or without even scrutinizing what goes behind that ultimate marketing of that supplement. I would say do not take supplements containing artificial sweetener, and this amino acid in the sense synthetically made, called the phenylalanine. It can be very, in most natural form, they are safe in whole food, like say your turkey, your chicken, and all that, and some of the plant food has got this. But if they already manufactured into a tablet and into a supplement that is loaded or manufactured synthetically or chemically, then you really want to avoid them, because they can alter the brain development of the fetus and include the other risks as well. So this is just one example. But if you are choosing whole food, then you really don't have to worry too much of what added in. For that whole food supplement. To me, I don't call them supplement, I call them concentrated nutrients, in a whole food form. So if you have got needs for any dietary shortfall to fill, I think the top of the list supplement I would want to recommend to you would be spirulina, because spirulina is not like an extract supplement. The whole thing is in there, whole food, in a whole food form. It's a very digestible protein, and protein is very important to build your baby's muscles and tissue building. Very rich in organic folic acid and iron. See that? And that's the next best you can do if you have dietary shortfall. 25 times more beta carotene than carrots, vitamin E, B12 and B complexes, major lacks in a lot of pregnant women. Minerals like calcium, magnesium, potassium, gamma linolenic acid, richer than evening primrose. So what you can do in powder form or in tablet form, you can take between 1 to 3 times depending on your diet. So if your diet is very short of folic acid and iron, then you really want to take up to 3 times a day to meet kind of compensate for dietary shortfall before you even touch any kind of iron pills. I'm not into iron pills, but I'm into iron in whole food in concentrated form, in the form of spirulina. So why is there a need to focus so much on folic acid? Because folic acid is so important to form healthy cells, especially the red blood count for the mom and the baby, to ensure a very healthy and safe pregnancy. Folic acid is also, like an iron. So if a mother were to bleed, and if the mother is already very depleted, it can cause, danger to the mother's life. They bleed. That means they don't have enough red blood cell to even support their whole natural process of a natural birth. And the other thing is to form the neural, the neural tube. It's very important, because mothers who don't have enough folic acid, they can have this birth defect, deform kind of a spine, that you see this hunch of this baby with a neck like too short, and then a hunch one way, and cannot even stand straight, and very, very short in most cases. It has got to do with the lack of folic acid. Prevents the birth defects of the baby's brain, anencephaly, and also the spine, called the spina bifida. So these are the common, even in developed countries like Singapore, this form the top kind of a range of birth defects, and it has got to do with deficiency in folic acid. So now it's so important for you to eat all the seeds and nuts, and then a lot of greens, vegetables, and then also compensated with spirulina if you feel that your diet is really not foolproof. Yeah. And of course, other forms of folic acid can come from like deep cold water fish, if you're not a vegetarian, and the food picture that I've seen here, that I've shown here. So the importance of folic acid, I can't emphasize it enough. It's very important for conception. So you should be taking it even before you plan or you conceive. And ideally, you should continue all the way to your full term if you are pregnant. Your dark leafy green, spinach, kale, right? Asparagus, broccoli, beetroot if you're not diabetic. Eggs must be organic, ideally. A lot of hormones in there if it is non-organic. Avocado, a lot of folic acid. Sprouted legumes, beans, peas, whole grains, papaya, and banana. So if you really have to, you have shortfall, then of course, I think with any exception that I always tell pregnant women, all right, I also think that folic acid prescribed from the clinic are not really natural. But if I find that between, taking the risk of the mother not having enough folic acid and then not taking the green juices, green vegetable, and not taking spirulina, and they say, okay, I don't want to take all this, then I said, then you better take some folic acid more as a precautionary, and then can do a detox after the pregnancy or when you wean off your baby after birth. After you have given birth, to clean up whatever chemicals are in there. But again, if you can, always go for organic one, in the whole food form. So 400 mcg to 800 mcg is needed even before pregnancy while planning for conception, and all the way to full terms. And then for women with previous infant already, let's say previous childbirth, right, having neural tube defects or taking this anti-epileptic medication that deplete their reserve for folic acid, they really have to go mega on 5 mg. You know how many times? Almost 20 times of a normal person's. So you can see how depleting these medications and situations are. So start taking it before conception up to at least 12 weeks of gestation. These are very essential to prevent the risk of neural tube birth defects. Then we talk about weight gain. This is a guideline for pregnancy weight gain. Depending on your BMI, you take a look at where you are in your weight. You can take a picture, or you want this list, I can send it to you, right? Then of course, the right-hand column talk about, if you know that your pregnancy has got twin or multiple features in there, then of course your weight gain is needed to support the pregnancy. So this is not the time to talk about losing calorie or restriction of calorie, but calorie in the right way, from whole food and in its most complex carbohydrates, if you are looking into the carbohydrates family. Now, the weight gain, I am not including, excluding those who have a BMI of above 30, that means very severely obese, right? Then you shouldn't put on too much weight. Then the baby may be too big and challenging and be dangerous, to give birth that way. But generally, if you have a BMI between underweight, normal, and a little bit overweight, you should be, ideally putting on anything between 7 to about 12 or 13, and in very underweight situation, then up to 18 over kilo. So if you are, let's say, having a BMI of above 30, then you try to limit to 9 kilo, 9.1 thereabout, okay? Calorie intake is very important. So again, there's not a time to talk about weight loss, talk about building, eating heartily and healthily. Trimester 1, 1,008 to 2,000 calorie. Okay, trimester 2, 2002 to 2003. Trimester 3, the baby is getting bigger and bigger. So you need more energy and you need more storage, to support that big, the growing baby waiting for childbirth. 2004 to 2005 kcal. Nursing mothers always feel hungry because it takes a lot. They drain out a lot of nutrients. They drain out a lot of energy when they are nursing. They should be ideally going beyond 2005, even up to 2008, depending on the demand, how much, how often, and whether they are breast feeding fully. But I will encourage that you breastfeed fully, at least up to the time where your baby, about 5 to 6 months, start to want to ready to take some cereal and all that, then you can cut down a few feeds. But if you can, I would suggest that ideally 6 months to 1 year is the baseline for you to really determine to breastfeed your baby. But of course, if you're a super natural mom, you can go up to 3 years. After 3 years, no point breastfeeding. Your baby would not need that anymore, ready to eat a lot of this variety of solid food. Okay, so this gives you an idea about the importance of having carbohydrates, right? Remember I told you about calorie, and that's why complex carbo, 5 to 6 servings a day is very important to support your pregnancy. So this is again a table for your consideration. Then we talk about the importance of milk, because I think a lot of times, whether conventionally or naturally, we are also concerned about dairy, how dairy affects not only the mother, but especially when mothers have got a lot of eczema. So drinking cow's milk can give the mother a lot of eczema problem as well. So and then the eczema, the allergens, the histamine released into the bloodstream can affect the baby. So that's why, a lot of young babies can be birthed already having this called the inclination towards hereditary factor of eczema. So I would suggest that while there are a lot of benefits in drinking this dairy or cow's milk, but do remember that they can give rise to all sorts of allergy because of the lactose intolerance for the baby or for the mom. And that can be very, very problematic to give rise to eczema, flu, gas, bloating, diarrhea, constipation, sinus, and a lot of digestive problem. I would personally think that the best thing to do is not only about cow's milk for the calcium, protein, and what have you, the zinc and many other nutrients in milk. But again, my criteria for a very good dairy product will be food intake during pregnancy will be to make them in the milk into yogurt. But you need to make sure that the milk used is not commercial milk. It's organic, and it ideally should be low fat. Okay, low fat, and we have it available at our center. We teach yogurt making classes. We even have this yogurt machine that we make available for people to eat very healthily. We have the culture, the machine, and also the calcium. It's very low cost to make your own yogurt, and it's a very important calcium and protein food. 1 cup of yogurt that you make, again, not commercially made, homemade, will give you as high as 400 to 450 mg of calcium. And don't forget, constipation is one challenge, common challenge as well. So it gives rise to a lot of friendly bacteria populating your gut. So it's very good for bowel movement as well. So I think if there's any top food, one of the top food for pregnancy, I would advocate organic low-fat yogurt, and ideally homemade. Colostrum is another whole food that you can explore. You can drink it on its own, or ideally put that and make it into yogurt together with your cow's milk or goat's milk yogurt. It's the first milk. It's loaded with a lot of immune dynamics, growth factors, IgG. IgG protects the baby and the mother's immune system and protects against allergy. So at birth, right, from the time of preconception all the way to birth, having IgG, which is an immune factor in the human body, is one important factor of how your baby immune system will work out as well. So we always advocate that putting it into yogurt or into your oats or breakfast and all that. It's very important. Yeah, DHA, EPA for bone growth and repair as well. So this is something that you want to consider. calcium, if you don't get it enough from your diet, you can actually take it from supplementation. What we use in our center is this complex that's very high quality to protect and to increase the need for bone and teeth development for the baby. It is said that, with every childbirth, a woman loses a tooth. So that tells you how important calcium is for the pregnant woman. So take a picture of this. This is the amount of the calcium that you need, 750 mg to 1000 first trimester. Second trimester, try to increase 1002 to 1005. Third trimester, you need 2000 from your diet or supplementation. Postnatal nursing time, you need up to 2003 amount of calcium to protect yourself from osteoporosis and to ensure that your baby's teeth and bones are very, very well developed. Okay, so the best way to take yogurt, I mentioned about yogurt as a protein, calcium-friendly bacterial food, is to go with flaxseed oil. So flaxseed oil is, this combination goes very well. And flaxseed oil is one very, very major essential fatty acid oil that is important for the brain development, as well as the immune system for both the mother and the baby. And I like to emphasize on the brain development and also to prevent the cleft palate for baby, newborn. It's got to do with the deficiency in omega-3. So flaxseed oil is something that you really want to focus on. Then of course, water. For water, you should choose only distilled water. Your water should not be commercially bought commercial can, bottled drinks loaded with sugar, coloring, flavoring. Drink distilled water, drink some fresh and fruits and vegetable juices. Avoid drinking tap water, chlorinated water. Avoid caffeine, coffee drinking limit or take out, that would be best, and strictly no alcohol during the pregnancy time, okay? Herbal tea selectively and with caution. Right. So I will cover four common conditions during pregnancy, and then with that I will end, and then how to overcome them with nutritional intervention. When we talk about nausea, nausea is not normal. It's not common. It doesn't come with pregnancy, but if it comes, it's got to do with nutritional deficiency. Iron. So you take spirulina juice, a low-fat diet, leafy greens, kale, broccoli, cauliflower, pomegranate, cold water fish, organic meat if you are not vegetarian ideally, or meat if you don't have to eat it, eggs and cereal. Smaller meals, break into 6 times. A very natural B complex is very helpful to overcome nausea. Constipation is another issue because not only the baby is growing and then pressing against between the gut and the womb and growing with the congestion in there in terms of the space. So this is when a lot of women can get into constipated problem as well when they are pregnant, more and more constipated as their pregnancy goes. So I would suggest taking a probiotic, we call it the Immunoflora, and then the herbal cleanse once or twice a day is something very important to kind of detoxify the colon on a day-to-day basis. Gentle exercise, because sedentary lifestyle can be one of the reasons why we get into constipated problem during pregnancy time. Gentle exercise, no rigorous, right? Walking, swimming, stationary, bike, low impact, aerobics, and gentle rebounding is helpful. Then the other 2 types will be hypoglycemia, low sugar. That's why they feel very giddy during pregnancy. It's got to do with them not eating complex carbo, not eating small but regular meals to distribute the sugar level. So change the pattern of eating, high fiber, digestible protein, and low sugar. Then the other swing will be hyperglycemia, gestational diabetes, high blood sugar. It's very dangerous because it can give rise to birth defects, toxemia, abnormal birth weight, and cesarean section necessity. Important to keep the sugar constant and stable. You need complex carbo to cut out the sugar. Put in more digestible protein to regulate your sugar and bring down the sugar level by taking a high fiber diet. So I can give you a lot more details on the meals and all the information. This session is just to give you an overview of things. So probiotic, again, we use Immune-Flora. We use how to overcome the constipation problem. Like you can say, choose a herbal cleanse. It's very safe for pregnant women as well. Yeah, see all these incrustations are being passed out during the detox time. So instead of taking multivit, the synthetic chemicals extract supplement, you may want to consider super green food, whole food kind of phytonutrients that is fully plant-based and whole food. Nutritional yeast is very important as a food. It's not a supplement, it's a whole food. See what it has, all the Bs, all the amino acids. And it's an anti-stress, particularly needed for the 15, women who are pregnant. They need a lot of trace minerals to support the growth as well. So you may want to eat 2 teaspoons of nutritional yeast if you can. Kelp is very important for trace minerals, for thyroid function, metabolic rate as well. Very important for mothers, the lack of trace minerals. And babies who have got mother eating enough kelp, they have very black bushy hair, very healthy hair. Bee pollen, whenever you're not eating well, lacking in protein, this is one whole food supplement for zinc. Remember, zinc is so important. And the many other rich source of trace minerals. So what I'm suggesting to you, not like extract supplements, they are basically predominantly a whole food supplement to fulfill your dietary shortfall. If you have leg cramp, water retention, then instead of taking this water retention medication, right, you may want to consider a food-based case called this potassium food-derived whole food kind of a potassium rather than synthetic potassium. That's very helpful not only to reduce the water retention during pregnancy, but it's also to relieve your leg cramp. Yeah. If mothers are having eczema, to prevent the eczema going down to the babies, very important during pregnancy time, do make sure you have your enzymes and your vitamin C intake. This is how we can break free, from the passing down of eczema for the newborn baby. So I can go into the details of how to intervene with enzymes and vitamin C for eczema mothers, and they want to prevent eczema passing down to their young babies. Yeah. And B complex if stress, not having enough rest, and to also minimize the risk of birth defect. So the B complex kind of family of nutrients in whole food form will be spirulina and nutritional yeast. If you still have extra need, then I think a very natural B complex will be very helpful as well. Okay, so I won't cover the exercise part. So I'll end this session to let you know that I have got a more detailed guide on conception and healthy pregnancy. If you want to, please put in the chat box, or you can send me this email.